Thank you for tuning into this video summary of a published AJR manuscript titled Synthetic 2D Mammography versus Standard 2D Digital Mammography, a Diagnostic Test Accuracy Systematic Review and Meta-Analysis. My name is Mostafa Alabousi and I'm one of the co-authors. I'll be telling you about this paper over the next couple of minutes. Starting off with some brief highlights, we found that the diagnostic accuracy of synthetic 2D mammography is similar to standard 2D digital mammography, with or without the use of 3D digital breast tomosynthesis. The objective of our study was to perform a systematic review and meta-analysis to compare the diagnostic accuracy of synthetic 2D mammography and standard 2D digital mammography, with or without the use of 3D digital breast tomosynthesis for breast cancer detection. The study was reported according to the PRISMA guidelines for diagnostic test accuracy systematic reviews. Medline and Embase were searched for relevant studies until September 11, 2019. The population of interest were patients undergoing breast imaging at average risk for breast cancer, both screening and diagnostic populations. The diagnostic tests of interest were synthetic 2D mammography and standard 2D digital mammography, with or without the reporting of 3D digital breast tomosynthesis, and the reference standard for histopathology or imaging follow-up. We were interested in comparative or randomized controlled trial study designs. We excluded single-arm trials or staging studies. Potentially relevant articles underwent title and abstract screening, followed by full-text screening. The included relevant articles had methodologic and diagnostic accuracy data extracted. They also underwent a risk of bias assessment using the QuadS2 tool. And for the included studies, the accuracy metrics were pooled using bivariate random effects meta-analysis, and meta-regression was used for statistical comparison of the diagnostic tests while accounting for multiple potentially confounding variables within these models. Now on to our evidence synthesis. Our research retrieved over 1,300 studies which were screened, of which we identified 13 relevant studies for the systematic review and meta-analysis. Of these, there were between 6 and 9 studies which contained relevant accuracy data on each of the previously mentioned diagnostic tests. We included over 200,000 patients in our analysis, of which over 7,000 had breast cancer. Within each of the individual diagnostic imaging test groups, there were between 20 and 64,000 patients and between 700 and 2,200 patients with breast cancer. Of the 13 included studies, 7 were at low risk for bias, while the remaining 6 were at high risk for bias. For synthetic 2D mammography alone, our pooled sensitivity was 75% and the pooled specificity was 92%. For the standard 2D digital mammography alone, the pooled sensitivity was 73% and the pooled specificity was 88%. For the synthetic 2D mammography combined with digital breast tomosynthesis, the pooled sensitivity was 85% while the pooled specificity was 93%. For the standard 2D digital mammography combined with digital breast tomosynthesis, the pooled sensitivity was 84%, while the pooled specificity was 91%. The comparative meta-regression model comparing synthetic 2D mammography compared to standard 2D digital mammography alone found no significant difference in sensitivity or specificity. Similarly, the comparative meta-regression model, which compared synthetic 2D mammography and standard 2D digital mammography, each combined with digital breast tomosynthesis, found no significant difference in sensitivity or specificity. In summary, we found that synthetic 2D mammography is non-inferior to standard 2D digital mammography, with or without the use of digital breast tomosynthesis. And based on these findings, synthetic 2D mammography may be considered as a potential first-line imaging test in place of standard 2D digital mammography, and this practice may result in reduced radiation doses. Just to go over the brief highlights again, this systematic review and meta-analysis of 13 studies and over 200,000 patients found that the diagnostic accuracy of synthetic 2D mammography is similar to standard 2D digital mammography with or without the use of 3D digital breast tomosynthesis.